College of Nursing is happy to welcome you to our commencement ceremony. Today, we are part of a proud tradition in health professional education. Today, we share your joy and pride. As a courtesy to your neighbors, please turn off or silence any cell phones or beepers. We will begin our ceremony with a video presentation about Upstate Medical University.
We are
Upstate.
We are Upstate.
We are Upstate Medical University.
4 colleges, 1 university.
My name is Taylor Solek from Upstate's College of Nursing. I'm an RN in Upstate's Surgical Trauma ICU. Every day I provide care to patients and families facing life-changing circumstances. I'm staying at Upstate to get my master's degree as a psychiatric mental health nurse practitioner to continue providing emotional support to patients and families.
My name is Matthew Moyd. I'm in the College of Health Professions Physician Assistant Program. My work as a phlebotomist with underserved populations has led me to Upstate, and I'm eager to work with communities in need.
My name is Lacy, and I'm in the College of Graduate Studies. I want to use my research to unlock the unknown and find cures and treatments for infectious diseases. Upstate has been my home away from home. My lab is like my second family.
I am Brandis Pearson. I'm a social worker, I'm a nurse, I'm a mother. And now Upstate has prepared me for my next goal, addressing healthcare disparities around the block and around the world. And that's why I traveled to Ghana.
My name is Gabrielle Berto, and I'm graduating from the College of Medicine. I chose Upstate because of its rich history of women in medicine. To carry on the legacy of pioneers such as Elizabeth Blackwell and Sarah Logan Fraser is very inspiring. My goal is to become a clinician educator, to train and teach medical students to become the healers of tomorrow, improving the health of the communities we serve
Through education,
Outreach,
biomedical research,
and healthcare.
united in expertise,
Compassion,
and hope.
to create a healthier world
A healthier world
for all.
for all.
for all.
We are Upstate Medical University.
4 colleges,
4 colleges,
4 colleges,
1 university.
One university.
And now, please rise as we introduce the Upstate graduates of the year 2018.
Welcome. It is my pleasure to introduce Dr. Tammy Austin Kench, Dean and Professor of the College of Nursing.
Welcome, graduates, family, friends, President LaReccarina, Dean Lucinio, and distinguished and honored guests to the 2018 College of Nursing Commencement Ceremony. As I look at our assembled graduates today from the College of Nursing, I am certain that the future of nursing is in capable hands. There is no more worthwhile profession than nursing. Graduates, as I ask you to take a moment and reflect on the innovative nurses who have come before us. Think of all the lives that will be touched during your careers. On the grandest scale, how will your career in nursing change the world? While on the individual scale, how will holding the hand of a preemie or the hand of an elder as they take their final breath make impactful changes as your patient enters or exits the world? Nurses can improve the world, be it local, regional, national, or international, by caring for and educating patients. As simple as it sounds, these skills can change lives. However, the greatest nursing skill utilized in any environment is that of being a strong advocate for the patient population that you serve. Our job as educators is to inspire you to be your best self as you leave the confines of the academic environment. Our aspiration for you is that you go forth into our fragmented and ailing healthcare system, becoming involved advocates for the profession and for your patients. The larger problems of our society and the world that we live in require knowledgeable advocates, which is truly in the wheelhouse of the nursing profession. The education that you received at Upstate Medical University College of Nursing makes you uniquely qualified to tackle these problems of the local community, the region, as well as the nation and global issues at large. No one person or institution can tackle all of these issues alone. So I challenge you to take what you have learned from your interprofessional education and urge others to work as a collaborative team to solve the pressing healthcare issues of our time. As you navigate your professional career, remember that nurses are entrusted with tremendous responsibility. Gallup polls have identified nurses as the most trusted profession for the past several years. With the high level of publicly perceived integrity that nursing holds, the profession has a special responsibility to guide decision makers in society in matters that deal with the health and welfare of the public that we serve. This is where our obligation as nurses to turn knowledge into effective advocacy comes into play. The future of nursing requires that as a profession, as well as individually, we speak loudly and persuasively about the issues that we identify in the delivery of healthcare as well as social policy. Graduates, we applaud your accomplishments and commend you for your perseverance, hard work, and foresight that has led you to this day. We hope that your experiences at the College of Nursing have strengthened your sense of purpose and inspired you to continue your quest for knowledge. This is not the end of your education, but an important step forward in your journey, whether you continue your education in a formal academic setting or in the world of life experience. In conclusion, I would like to leave you with a final but poignant thought that echoes the core values of nursing. In the words of Nelson Mandela, education is the most powerful weapon that you can use to change the world. Wherever you go in your future endeavors, we hope that you will stay in touch and will let us know of your challenges and accomplishments. Well done, class of 2018. Now let's continue with this ceremony and the celebration of your accomplishments.
Thank you. It gives me great pleasure and honor to present Dr. Daniel LaRoccarina, President and Health System CEO of the State University of New York, Upstate Medical University.
So welcome, families. I want to thank Dr. Tammy Austin-Ketch. It's a pleasure to have you here and to hear your words of wisdom to our graduates. Students, families, colleagues, distinguished guests, and honorary recipients, and Carolyn Jones, John William Pup, and Tracy Shenandoah join us today to celebrate the accomplishments of our trainees and our Board of Trustees, Eunice Lewin, shortly. This year, as I reflect on this day of new beginnings, I take stock of the previous academic year. The theme for me this year, and you may know that I give 4 of these today, right? I started at the College of Health Professions, and continuing now to the College of Nursing graduates. We'll go on to talk to the Graduate Studies graduates, as well as the College of Medicine. And I hope that my words have particular meaning for the College of Nursing. But each year, I think we all face various challenges and reflect back and see what's been accomplished, what has been learned, and what can be applied in facing the challenges of the next year. So, as I reflected with our colleagues this morning, I take stock of the inner workings of our university. And while I won't have the time to talk to you about the intricacies of relationships and how the university functions, I also want to reflect that we're not in a bubble, that in fact we are within the context of lives that go on the whole time that your students here have devoted their time. They don't live in a bubble, they live in the context of the broader world. So I will make some reflections on that. So you, the graduates of the College of Nursing at the undergraduate and graduate level, have much to teach us. But I'll recap for family and friends, and I think you may have lived through some of their trials and tribulations, but I'll recap for you what the College of Nursing, in fact, entails. And do you allow me to do that, Dean? Yes. Very good, because as a physician, I am imposing a little bit in going through and commenting, but again, we are a team. So from my perspective, the College of Nursing has evolved, has expanded, and the profession of nursing in the recognition of the central role of the nursing profession in the delivery of health care, and also in the science of improvement of health. You know, we don't have it all right today. I think you probably, if you've interfaced with any healthcare system, you in the audience would tell us that. We don't have it yet right. And so the improvement of health comes through repeated cycles of failure and learning, and that is what we are all engaged in. The curriculum at the undergraduate level consists of an array of courses, and I thought I would share that with you because it was enlightening for me, although I work with students all day long and I see them at least in the colleges. The curriculum has an array of courses at the undergraduate level, such as epidemiology, quality of care and safety, management, and health policy. At the graduate level, the nurse practitioner programs have specialized in the distinct clinical areas such as psychiatry, pediatrics, and family medicine. At the doctoral level, biostatistics, program development, organizational behavior, and systems leadership define the attainment of the Doctor of Nursing practice. At the heart of all of these, of the levels of study, is the ethic, as I understand it, of the nursing profession that focuses distinctly on relationships, human dignity, and collaborative care. So those are the comments that I will make to you. In the course of study exemplified by the curriculum, you students, and I said this to your colleagues, and I will say it this afternoon, you stand here or sit here ready to receive your degrees. And the question for those of us who have been your instructors and professors is whether or not we have prepared you well. And you will be the critics of that, and you will be recognizing whether we did our job well. And have you been prepared also by what you experienced not only within the College of Nursing, but in the context of the broader world? The former question is particularly poignant for our nursing students. And I give a slightly different message to each of the professions. So while we work well together, or we must work well together, we are very distinct in what we bring, which is the best part of collaboration, that you bring each complementary skills and passions to make a difference. So most of you have pursued higher education while working full-time. I want to take a note of that. That is unique. Most of our students at the graduate level, as well at medicine, graduate studies, and even the health professions, have not had that experience to the degree that you, our nursing students, have done. That is something to be noted. I think that shows an unparalleled commitment to your discipline. You embody the integration of clinical expertise and academic achievement. Some of the examples in the curriculum innovations, and I thank Dean Austin Ketch for sharing some of this with me, is the BSN Baccalaureate in Nursing in 10. So on December 20th of 2017, Governor Cuomo signed into law a requirement that nurses earn a BSN within 10 years of initial licensure. As background, the American Nurses Association House of Delegates adopted a motion in 1964 supporting baccalaureate education as educational foundation for the registered nurse. In response, Upstate has just launched its RN to BS online approved by the State Education Department. And you know, in the 21st century, so much of our education is online, and our young learners, and I mean young in terms of their profession, not age, have told us that we need to apply that pedagogy in very, very different ways. Online postgraduate Doctor of Nursing practice is structured to accommodate the working professional utilizing innovative teaching and learning pedagogies. Under the leadership of our new Dean of the College of Nursing, the College of Nursing is increasing our partnership with community partners through behavioral health workforce, something that is very much neglected in our healthcare system and education, and a training grant which helps to support our family's psychiatric mental health nurse practitioner students. So I really commend the innovations in that. Well, do these programs matter in your training would be the key question that you should ask, and you will test that out as you venture into the world. You are in the world, but you know what I mean. Do these curricular changes translate into fundamental shifts in responsiveness to health needs, and these changes determinant in leading to improved health outcomes? And also another issue, elimination of disparities in care, the care that's given to different communities. Are we having the same outcomes? Are we driving in the same way to make sure that all of us are treated with compassion and the highest quality care? And for you, I have an answer. I have a question for some others. But when I thought about the College of Nursing, I said a resounding yes. That your training and your discipline is already doing that. And so you must lead the way. You must lead the way. Advanced practice nurses have fundamentally changed the practice of medicine, and the graduates of this profession have led quality initiatives, interprofessional practice innovations, and family-centered care. The family needs to remain at the center. And while all of this was going on in this past year, I stated this earlier this morning as well, what has been happening in the rest of the world. While the other students in other colleges have had the benefits of our campus activities, programs inclusive of the things I mentioned, such as sports and recreation facilities and lots of student organizations, you students of the College of Nursing have not always been able to take advantage of that. You have had to incredibly balance work and education. I know that from conversations with those who teach you and through some conversations with you, leaving little time for on-campus activities. Nonetheless, leadership in the nursing student body is evident. Thank you. So some of the events that I share with you in the context of what's happened in our world while you were busy studying, which is exactly what you should be doing, I have the following remarks. The Me Too, hashtag Time's Up, hashtag Enough movements occurred with the declaration on the front cover of the Times Magazine on December 18th of 2017 of the Person of the Year, the Silence Breakers, who exposed on a global scale the flaming issues of sexual harassment in the workplace, in education, and throughout our society. Some of these topics may be uncomfortable for us to talk about. This brought even greater focus to Title VII of the Civil Rights Act of 1964 and Title IX, prohibiting discrimination of protected classes inclusive of gender and around the world, the realities of bias are even more acute for women and girls with the most challenging circumstances limiting their rights to health and education. Our nursing profession, traditionally whose students have been overwhelmingly women, and I think that still continues today, but welcome the men in our midst who have chosen this profession, okay, are the largest number of healthcare workers and are gaining ground in an equal footing with medicine as recognized as researchers, policymakers, and the core of the multidisciplinary care that Dr. Austin Ketch talked about needed by our most complex patients. Other events, a prominent focus of our attention has been, and the Syracuse area unfortunately knows this reality, has been the opioid epidemic. In my recent walking tour of our clinical enterprise, I had the honor of meeting Theresa Baxter, a master's graduate level trained family nurse practitioner, a member of the acute pain service. That means the service that responds when patients are hospitalized or in pain and how to mitigate that pain. At the urging of Dr. Tim Andy, the chair of the Basic Science Department of Immunology and Microbiology, I met 3 patients, and I no longer see patients, unfortunately. 2 years ago when I took this position, I had to stop seeing patients because you need your full attention. You need to be undisturbed when you care for patients. I met 3 patients hospitalized with a diagnosis of heroin addiction and complex mental and physical ailments. Dr. Andy and Ms. Baxter wanted me to understand the complex web of clinical and emotional challenges to patients suffering from opioid addiction. They and the chairs of psychiatry, medicine, emergency medicine, and the chief nursing officer representative wanted me to understand the need for unwavering support for a multidisciplinary, integrated service to meet the acute and long-term needs of patients so afflicted. Among us, we may have family members or friends who have that experience. Unanimously, the group of expert clinicians stated that the most crucial individual in this plan of addressing the needs of the patients I just described was Theresa Baxter. They didn't blink. Her compassion, unfailing expertise, and commitment to the patients and their needs, her understanding of the science and the treatment of addiction was truly extraordinary and indispensable. So what words, in closing, of wisdom can I possibly share with you today, your day of commencement? Well, the word that I will share with every commencement announcement that I make today is, and I was feeling somewhat low in thinking about the number of challenges we have before us. That word was courage. And I would say to you, have courage. First, I reflected with them that I reflected in my own thoughts that courage, I echoed that to a room of 450 interfaith social justice organizational members who had invited me to give a keynote speech. And their commitment was displayed by many things, but I'll move on to our graduates. I say, have courage. So graduates of the College of Nursing, when you think you are the lone voice on rounds advocating for the patient's perspective of a treatment plan, have courage. Have courage when you are alone at the bedside of a dying patient, because although medicine has become much more attentive to how we die, not just how we live, but how we die, that nurses have known this for decades. And it has been central to your profession. You have much to teach the rest of us. Have courage when you call out in the OR in timeout that the identified procedure is in fact incorrect and the procedure must stop to correct that error. Have courage when you struggle to balance your personal lives with your deep commitment to your profession. We are all eminently indebted to you for your compassion, expertise, and caring for those who need you most. Congratulations on your achievements today.
Student speakers, Mr. Peter Karandayoff, a graduate of the Bachelor of Science in Nursing program, has been invited to speak as the undergraduate student speaker. Will Mr. Karandeoff please come forward?
Thank you. Good morning, everyone. Thank you all for coming. I was very honored to be chosen to represent such an exceptional group of students. A little bit about myself. I'm originally an immigrant from Russia. My family and I flew over here in about 1997. We were in search of greater opportunity in the land of opportunity. I attended grade school in Lansing, and as time went by, I became a Tompkins-Cortland Community College undergraduate. I went straight into their nursing program from high school and subsequently passed my boards, landed a job in the medical ICU downtown, and applied for the Bachelor's of Science program here at Upstate to start classes the same year. Why such a rush to get into Upstate? Well, it's mostly because of my father. That's right, Dad. Believe it or not, you actually made me do something. In 2011, I was a 10th grader at LHS, and I heard that my father hit a deer on his motorcycle going about 50 miles an hour. Having been transported to Upstate for a higher level of care, the surgeon basically had to put his knee back together like a puzzle. My family and I visited each week until he got home. Every time I came there, I marveled at the size, professionalism, and the beauty of this institution. Upstate is the only Level 1 trauma center, leading comprehensive stroke center, and most comprehensive cancer center in the region. And at that time, as a 16-year-old adolescent, I decided that I'd become a part of this world. Upstate's bachelor's program is a blended program with both face-to-face and online courses. Therefore, I had the pleasure of meeting my classmates in person during group projects and lecture-based courses. Those of you that have taken online courses understand. However, those that haven't, it can be quite surprising to see who you're actually dealing with. One moment you're convinced that you're talking to an average Joe, and then you meet the guy, and he's actually a professional soccer player from Kenya who's married and has 2 kids. Furthermore, meeting instructors both online and in person was a true eye-opener. They are phenomenal. Not only are they knowledgeable and skilled, they care about their students' success and professional development. They will work with you for as long as you need, after class, working with conflicting schedules, setting up appointments, and providing the most useful feedback to facilitate understanding. Many of us, including myself, have been employed part or full-time, like President Lacarina said, and this adds to the everyday stresses and burnout of our jobs. Some have children, some have no jobs at all, and yet each instructor ensured that every student was not left behind. The learning curve I underwent was very great. I have been transformed by the prestige of this university. I always felt like I had to do better because I was an Upstate undergraduate, and an employee. This brings me great honor and pride. The folks who have come here can attest to my professional development since I began. Even my girlfriend from California noticed. She's actually here to see me through. I love you, Anastasia. She's a gem. This program has changed all of us in the best of ways. Its coursework was heavily focused on research, critical thinking, and professionalism. Our acquired knowledge has versatile applications. At home, at school, in the workplace, we've built confidence through the ability to organize our work, where we reviewed institutional policies and proposed their alterations, evidence-based practice research that can be published. It has empowered us to take leadership roles and implement higher levels of understanding and decision-making. At the very beginning, my instructors made students write down different vocabulary terms to define the philosophy of nursing. At the end, the same assignment was given, and the difference between the original and the new terms was enormous. We didn't change our original perspective, though. We transformed it, and thus we began the path to become transformational leaders. This is defined as the basis of motivation, morale, and performance of followers throughout the variety of mechanisms, including connecting, I quote, connecting the follower's sense of identity and self to the mission and collective identity of the organization, being a role model for the followers that inspires them, and understanding the strengths and weaknesses of followers so the leader can align followers with tasks that optimize their performance, end quote. This is a quote from langston.edu. Something that we also learned here was to reference everything. And I know for a fact that this is exactly what we will do, thanks to Upstate. It feels like a long time coming, but our 2 years really did pass by. It's bittersweet to part our separate ways. Some are going to graduate school, some to other different states, myself included. However, I know that anywhere we go as Upstate undergraduates, we will bring our skills and knowledge with us to transform the institutions, to transform healthcare, and ultimately to make this world a better place. I'll always remember and cherish our time here. Congratulations, all of you, all of us, on this beautiful day of May 20th, 2018. We made it.
Thank you for citing. Ms. Taryn Lindquist, a graduate of the Master of Science program, has been invited to speak for the graduate students. Will Ms. Lindquist please come forward?
Welcome, all fellow graduates, faculty, President LaRocca Reina, Dean Giulio Licinio of the College of Medicine, our honorary degree recipient, Ms. Carolyn Jones, family, and friends. I stand before you today, thankful, honored, and humbled to represent the Upstate College of Nursing and those receiving a nursing degree here today. Arthur Ashe was a professional tennis player and the first African-American man to win not only one Grand Slam title in 1980, but also to be ranked #1 in the world with 3 career Grand Slam victories. Ashe contracted human immunodeficiency virus, known as HIV, through a blood transfusion during cardiac bypass surgery. Ashe became a humanitarian who dedicated his life towards public health awareness through the Arthur Ashe Foundation for the Defeat of AIDS. A quote from Ashe states, "Start where you are, use what you have, do what you can." This quote resonates with me not only at the start of my nursing career nearly 5 years ago, but also as I embrace a new role within the healthcare domain in the upcoming months. I swear, the anxiety of nursing school is a feature meant to prepare one for the ultimate responsibility of taking the health and well-being of others into our nurture. Whether you are stepping into your first 12-hour shift as a registered nurse, beginning your premier lecture as a clinical nurse educator, or seeing your first patient in clinic, you must start where you are. In our respective educational degrees, we are prepared with the tools and comprehension to successfully help us navigate patient care. As tennis sensation Ashe never imagined being faced with illness, he was able to utilize his influence and illness to educate others. As future nursing professionals, we all enter with different experiences, backgrounds, and circumstances. We must use what we have to do what we can. In addition, we must continue to grow, obtain knowledge, and evolve all throughout our practice. The Association of American Medical Colleges report that by the year 2030, there will be a shortage of approximately 7,300 to 43,100 primary care physicians. By 2026, the Centers for Medicare and Medicaid Services predict the United States healthcare spending will reach $5.7 trillion. 75% of all healthcare dollars are currently spent on patients with one or more preventable chronic conditions, including diabetes, obesity, heart disease, and lung disease. By 2020, retiring baby boomers will more than double Medicare and Medicaid costs and account for approximately 23% of the population, roughly 74.1 million people. As of 2017, the CDC reported that 26 million Americans were uninsured, and nearly 43 million Americans suffered from a mental health condition, of which 56% did not receive treatment. It is without question that the current state of healthcare in the United States generates a reality in nursing to both face challenging obstacles as well as bestow a rewarding profession of contribution, purpose, and impact. Ask anyone why they became a nurse. Evidently, job opportunities are ample. However, most responses include both the power to make a difference and the privilege to care for others. While the statistics previously revealed seemed quite overwhelming, much as working in healthcare often feels, The opportunity to make a difference is limitless. How fortunate we are to have the vocation, training, and ability to contribute to the solution with each and every patient. Primary intervention is imagined to be the solution in this healthcare conundrum. We are agents of change through promotion of awareness and education, screenings and evaluation, diagnoses and treatment plans, empathy and benevolence. Now, in the words of Dr. Jansen, does anyone need a break before our last case study? Patient presents with fatigue, brain fog, and stress. Onset 2 to 3 years ago, depending on what program you're in. Aggravating factors entail OSCEs, tests, quizzes, SOAP notes, Typhon logs, clinical, case studies, discussion board posts, research papers, and deadlines. Relieving factors include reflective learning journals, pass-fail grades, naps, and spring break. Treatment includes caffeine and, in my case, tears. Social history is irrelevant. Non-existent social life since onset of symptoms. Diagnosis, nursing school. Treatment plan, graduation. Education, PRN studying for board exams. Administer self-care, such as sleep, regular meals, exercise, hobbies, and implementation of a social life. Laugh daily, live your best life, cherish your health, stay positive, work hard, ask for help, nourish your passion, never stop learning, celebrate your success. Thank your family and friends for the endless support. Start where you are, use what you have, and do what you can. Congratulations, class of 2018, you did it.
Ms. Lacy Morgan, a graduate of the Doctor of Nursing Practice program, has been invited to speak as the doctorate student speaker. Will Ms. Morgan please come forward?
Good morning, family, friends, President Lorette Arena, Senior Vice President for Academic Health Affairs and Executive Dean Dr. Giulio Licinio, faculty, and fellow graduates. Well, we made it. We accomplished a major milestone in our lives by graduating from SUNY Upstate today. Congratulations. My name is Lacy Morgan Weller. I am a family nurse practitioner and DNP graduate. I work in a primary care office in Charlton, New York, a sleepy farm town between Schenectady and Saratoga Springs. I started my time at SUNY Upstate as a master's student, graduating in 2013. My dad is a primary care doctor and also a graduate of SUNY Upstate, while my mom is a registered nurse and a graduate of Krause Nursing School, just a stone's throw up the hill. I like to think I was born into healthcare, and it was only a matter of time that I found nursing to be my calling. For many of us, this has been a long road with many sacrifices and hardships. We've missed countless family dinners, sports games, trips, and many hours of sleep in order to complete these rigorous programs. Our DNP cohort was small but mighty, with 2 students graduating in our cohort this year. Along with these hardships, it was also filled with great milestones. I was engaged and married during my doctorate program, bought a house and moved, while another student kept busy having twins and somehow kept up with the heavy course load. We all have advanced in our jobs, volunteered in our communities, and all the while thrived as students again. We all work hard, and we've worked hard to get to this day, and our work did not go to waste. Graduation is just the beginning. Now we will start new jobs, return to old ones, begin faculty and teaching positions or leadership roles in our communities, hospitals, and healthcare organizations, all with the skills SUNY Upstate has helped us to master. Today, I'm graduating with a doctorate in nursing. The DNP is a doctoral degree focusing on the clinical practice of nursing. The degree represents the highest academic preparation for nursing practice. The curriculum focuses on the knowledge needed to provide comprehensive, direct care across settings, and it prepares practitioners to practice independently with the most complex patients in any setting where the patient requires care, utilizing complicated informatics and evidence-based decision-making. We are leaders, problem solvers, mentors, educators, and human beings. Doctorally prepared nurses do what nurses do best: connect with patients and treat them as a whole person, not just a diagnosis. We as nurses share this achievement of graduation, as well as the responsibilities of providing care to our patients and their loved ones. As we continue to grow and learn as nurses and advanced practitioners, we will learn quickly that real life is nothing like school. It does not follow the perfect algorithm or list of symptoms. It is never simple, but simple is not what we signed up for. SUNY Upstate has provided us with the tools to succeed and strive for excellence. Atul Gawande is a surgeon, writer, and public health researcher who works at Brigham and Women's Hospital in Boston. He has written many books about the complex art of medicine and nursing. These works have helped me navigate and balance the world of education and clinical practice throughout my time as a student here. And I will close today with a quote from him that I feel speaks true to everyone's journey as nursing professionals. He stated, when practicing in the healthcare field, don't let yourself just be. Find something new to try, find something to change. Count how often it succeeds and how often it doesn't. Write about it, ask a patient or a colleague what they think about it, see if you can keep the conversation going. So here's to keeping many more conversations going about the integral role of nursing in healthcare today. Here's to the long and bright futures of everyone in this room. The future of nursing is in our hands. Congratulations, class of 2018. I wish you all the best and look forward to hearing about everyone's accomplishments in the years to come. Thank you.
Now be conferred by President LaRock Arena. Dr. Tammy Austin Ketch, Dean of the College of Nursing, will present the recipients of the degrees in the College of Nursing. Students receiving academic honors have met the following grade point criteria: summa cum laude, 3.9 to 4.0, magna cum laude, 3.75 to 3.899, cum laude, 3.6 to 3.749.
President LaRock Arena, as Dean of the College of Nursing, I have the honor to present these recipients of the degree Bachelor of Science. With the completion of the curriculum, they will have satisfied the requirements established by the faculty and have been recommended by the faculty for the conferring of this degree.
Will all candidates for the Bachelor of Science degree in the College of Nursing please rise? By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon you the degree Bachelor of Science, with all its rights, privileges, and obligations. Please come forward to be individually recognized and for induction into the College of Nursing Alumni Association.
Suzanne Michelle Belden, Bachelor of Science, cum laude. Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Haley Fuchs, Bachelor of Science, cum laude. Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Cheryl Colanco, Bachelor of Science, cum laude. Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Jacob Magaya, Bachelor of Science, summa cum laude, valedictorian, baccalaureate level. Nicholas Nettie, Bachelor of Science, magna cum laude, Undergraduate Student Leadership Award, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Andrew Nodelman, Bachelor of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Rebecca Webster, Bachelor of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Peter Karandayev,
Bachelor's of Science, Sigma Theta Tau.
Go ahead, go.
Thank you.
Throw those right in the trash. Right underneath you. And now, you're going to then shield to the next part.
President Arena, as Dean of the College of Nursing, I have the honor to present these recipients of the degree Master of Science. With the completion of the curriculum, they have satisfied the requirements established by the faculty and have been recommended by the faculty for the conferring of this degree.
Will all candidates for the Master of Science degree in the College of Nursing please rise?
Impressive.
Okay, I think you're well liked. By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon you the degree Master of Science with all its rights, privileges, and obligations. Please come forward to be individually recognized and for induction into the College of Nursing Alumni Association.
As we individually recognize the Master of Science graduates, they will be hooded and congratulated by their individual program chairs.
Masters of Science graduates are being hooded by Dr. Michelle Jansen, Dr. Bambi Karki, and Dr. Joyce Scarpinato. Jenna Adranson, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Rachel Bailey, Master of Science, cum laude, Graduate Student Leadership Award, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Catherine Ballone, Master of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Jane Barker, Master of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations.
Thank you.
Justin Beebe, Master of Science, summa cum laude, valedictorian, master's level. Follow me. Gatane Bellamy, Master of Science, summa cum laude, valedictorian, master's level. Joshua Blodgett, Master of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Jamie Bloom, Master of Science, cum laude. Congratulations. Laura Borowski, Master of Science, summa cum laude, valedictorian master's level, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Mark Brew, Master of Science. Go ahead. Brittany Carradine, Master of Science. Carradine. Erin Carol Capanino, Postmasters Advanced Certificate. Congratulations. Eileen Cooper, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Kelly Sarnecki, Master of Science, Nurse Educator Certificate Program. Congratulations. Tiffany Damon, Master of Science. Kira Daneker. Kira Daneker, Master of Science, summa cum laude, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Shannon Dwyer, Master of Science, summa cum laude, Nurse Educator Certificate Program, valedictorian, master's level. Ebony Time, Master of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Corden. Kelly Corden, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Janae Brow, Master of Science, summa cum laude, Nurse Educator Certificate Program. Alexis Coughlin, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Julie Dewey, Master of Science, magna cum laude, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Taryn Lindquist, Master of Science, summa cum laude, valedictorian, master's level, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Lauren Edline, Master of Science, magna cum laude, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Jennifer Fuller, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Krista Atkins, Master of Science, summa cum laude, valedictorian, master's level, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society.
Thank you.
Kyla Kennedy, Master of Science, summa cum laude. Congratulations. Thank you. Lindsay Hayes, Master of Science, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Jordan Woodside, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Allison Kaiser, Master of Science, cum laude. Woo! Kajal Gandhi, Master of Science. Mitzi Lysis, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Kathy Griffin, Master of Science, summa cum laude, valedictorian, master's level, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Courtney Hafner, Master of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Lindsay Hahn, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Brittany Haggard, Master of Science, summa cum laude, valedictorian master's level, nurse educator certificate program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Annette Herbig, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Ann Hewitt, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Rachel Hill, Master of Science, magna cum laude. Congratulations. Irvine? Okay, go ahead. Laura Irvin, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Amelia Johnson, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Eugene Jung? Yeah. Eugene Jung, Master of Science, magna cum laude. Katrina Karboniczak, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Go ahead. Alicia Kell, Master of Science, summa cum laude, valedictorian master's level, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Okay. Tara Lynn Kohanek, Master of Science. Congratulations. Okay, go ahead. Bridget Loper, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Lastly. Betty Lockbury, Master of Science, cum laude, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Aisha Labiga, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Daniel McElroy, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. McPhee. Catherine McPhee, Master of Science, summa cum laude, valedictorian master's level, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Eric Mueller, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Mark Manansella, Master of Science, summa cum laude. Thank you. Okay. Emily O'Hara, Master of Science, magna cum laude.
Thank you very much. Yes.
Okay. Nicholas Pekarski, Master of Science, cum laude. Caitlin Phelan, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Lydia Prue, Master of Science, summa cum laude, valedictorian master's level. David Porter, Master of Science, summa cum laude, valedictorian master's level, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Jane Ogunsede, Master of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Mara Riley, Master of Science, summa cum laude, valedictorian master's level, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Shannon Roach, Master of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Stacy Schnebel, Master of Science, summa cum laude, valedictorian master's level, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Sarah Schell, Master of Science, summa cum laude, valedictorian master's level, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Mary Shaven, Master of Science, summa cum laude, valedictorian master's level, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Jamie Scheffler, Master of Science. Congratulations. Okay, go ahead. Caitlin Tomko, Master of Science, magna cum laude. Congratulations. You okay? Oh, yeah. Deirdre Wall, Master of Science, cum laude, Nurse Educator Certificate Program. Congratulations, Kevin. Kevin Wall, Master of Science, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Congratulations. Wait. Mary Walsh, Master of Science, magna cum laude, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Justin White, Master of Science, cum laude, Nurse Educator Certificate Program, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Anna Wright, Master of Science, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Sure. Christine Zachman, Master of Science, magna cum laude, Nurse Educator Certificate Program. Patricia Zalewski Gibson, Master of Science, magna cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society.
President Loretta Arena. As Dean of the College of Nursing, I have the honor to present these recipients of the degree, Doctor of Nursing Practice. With the completion of the curriculum, they have satisfied the requirements established by the faculty and have been recommended by the faculty for the conferring of this degree.
No, stay there, Lacy. Stay there.
Will all candidates for the Doctor of Nursing Practice degree in the College of Nursing please rise? By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon you the degree Doctor of Nursing Practice with all its rights, privileges, and obligations. Please come forward to be individually recognized and for induction into the College of Nursing Alumni Association.
Graduates in the Doctor of Nursing Practice program are being hooded by Dr. Joyce Scarpinato and Dr. Melanie Kuhlman. Dr. Brandy Balarjan, Doctor of Nursing Practice, cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Dr. Ann Fons, Doctor of Nursing Practice, summa cum laude, Omicron Alpha Chapter of Sigma Theta Tau International Honor Society. Dr. Lacy Morgan, Doctor of Nursing Practice, summa cum laude.
President Loretta Arena, I have the honor to present the recipients of the Postmasters Certificate Program. They have satisfied the requirements established by the faculty and have been recommended by the faculty for the receipt of the certificates. Yes, we do.
Sorry about that. There's a detail. So will all candidates for the Postmaster's Certificate in Nursing please rise? I offer my sincere congratulations. Please come forward to be individually recognized and for induction into the College of Nursing Alumni Association.
Hillary Kelly, Postmaster's Advanced Certificate.
Today, the State University of New York, Upstate Medical University, will award an honorary degree to Ms. Carolyn Jones. Mr. Thomas Taylor, member of the Upstate Medical University Council, will read the citation and Dr. Tammy Austin-Catch will assist me with the hooding.
Citation from the state of New York. Carolyn Jones, you have distinguished yourself as an award-winning photographer and filmmaker. As a veritable anthropologist, you explore unique aspects of our culture that have become powerful sources of learning. Your documentaries and publications do more than educate, illuminate, inspire, and affirm. They resonate your passion through personal stories that connect humankind. You are an inspiration as an educator and as an advocate. As a humanitarian, you have explored issues of global concern, including complex concerns facing our planet and the resources we share. You have selflessly devoted your career to celebrate invisible populations and break down barriers. Your poignant storytelling helps us embrace life. You have given hope to those diagnosed with AIDS, advocated for women artisans that support entire communities, and supported nurses on the front lines of our healthcare system. By unveiling the fragile junctures one can face in life, you have defined what makes life worth living for the rest of us. You have mined into the resilience of the human spirit, exploring the will to live and the power of hope. You show us that amid the complexities of illness and death, optimism and choice are not mutually exclusive from the former. You have been honored with numerous awards and recognitions. Your outstanding work dovetails with the mission of Upstate Medical University and our vision as a resource to improving global understanding of health and disease. For your contributions and dedication in all these fields, the State University of New York is pleased to confer upon you the degree of Honorary Doctor of Fine Arts, given this 20th day of May, 2018. I have the honor to present Ms. Carolyn Jones, a candidate for the degree of Doctor of Fine Arts, honoris causa.
What an extraordinary honor. Oh my goodness. Thank you, President LaRocca-Reina, members of the faculty, family and friends, and oh my goodness, the graduating class of 2018. I'm so excited to be here with you. I can't even begin to tell you. I think I've been dubbed a nurse wannabe for a while now, so this gets me a lot closer, and that's a good thing. I'm a journalist, an author, a filmmaker, who's really spent the last 6 years in the world of nurses. I've interviewed, photographed, and followed nurses extensively. And what a journey it has been. I was lucky enough to make a book, The American Nurse, and a film, The American Nurse, Healing America. As I was preparing for my second documentary, I realized that I really kind of wanted to put one toe into the world of nursing in a new way. I wanted to get closer to the experience that you had. So I decided to volunteer at Bellevue Hospital. Now, I don't know if any of you know Bellevue Hospital, but it's a very diverse population in New York City, which is my community, where I'm from. And that's where I wanted to volunteer. So I went through a 6-week training course where we learned all about HIPAA rules and how to talk to patients and what to do and what not to do. And I was proud to get through that little course. I know it's nothing compared to what you've been through today, but it was big for me. And at the end of the course, I got this little badge, and it had my photo on it, and I had a lanyard that said Bellevue Hospital, and a clipboard, and I was pretty excited to go to my first day of volunteering. So it was a Tuesday, and I went to the 6th floor of Bellevue Hospital with my little pearl earrings and my hair in a bun and my little clipboard. And this nurse is sitting at the nursing station, and she takes one look at me up and down, and she looks at me over her glasses, and she says, "Do you speak Spanish?" And I said, "No, I don't speak Spanish." And she's a little bit disgusted. And then she says, "Well, do you speak Chinese?" And I said, "No, I'm afraid not." And now I'm feeling shorter than I was when I got there. And so she kind of looks over her shoulder and she says, hey, does anybody have a patient that needs a friendly visitor today? And the gentleman in the back says, hey, send her to Mr. Sullivan. He hasn't talked to anybody in 4 weeks. And I'm thinking, okay, so that's how it's going to be. So let me at him, right? So I go into Mr. Sullivan's room, and now they had taught us if we were going to sit with someone that we ask if they'd like to have our company. So I go into the room, and I go around the corner, and Mr. Sullivan is like wrapped up in a fetal position with his back to the door. And I go in and I say, hi, Mr. Sullivan, I'm your friendly visitor for the day, and I wonder if you'd like for me to sit with you. Now, I realize this isn't going to be the moment that Mr. Sullivan breaks through 4 weeks of silence to say, yes, you may sit down. But I'm trying, right? I'm trying to make contact. So I remembered that book where the guy like dictated an entire book by blinking through the alphabet. So I thought I would do this with blinking. So I said, Mr. Sullivan, if you'd like for me to have a seat with you, blink once. And I waited a minute, and I thought he blinked, so I had a seat. So the other thing that they said to do was if you have a patient who's kind of non-communicative, talk a little bit, just chat, just talk about anything. So I did that, and I'm thinking after a couple minutes, this would be really irritating if the guy just wanted to have some peace and quiet. So I said, Mr. Sullivan, if you'd rather I just sat here quietly, blink your eyes twice. This time I was pretty sure he blinked his eyes twice. So I sat there quietly, and I went to visit a couple other patients that day, and that night I went to hospice training. And in hospice training, we learned how to give a hand massage that night. And I'm thinking, oh, this is going to be great for Mr. Sullivan next week. So the next week I go back to Bellevue, same nurse at the nursing station. I'm pretty sure she didn't think I was coming back. And this time I've got my little jar of hand lotion with me. She sees me coming, and I come up to her and I say, do you think it would be okay if I gave Mr. Sullivan a hand massage? And she's looking at me like, yeah, you do that. That's going to be great. So I go into Mr. Sullivan's room, and I go through the blinking thing, and I'm pretty sure it's okay, and I'm giving him this hand massage. And after a couple minutes, he grabs my hand, and he stops me. And it wasn't like, stop, you're hurting me. It was like, there's a human being there. There's someone I'm connected to. And for me, I know this sounds so small, but it was such a profound moment of connecting with someone in this kind of physical and emotional way. And I went home that night, and I was all excited that I had gotten through to this patient. I was kind of delighted that I'd had this connection. And I couldn't wait till the next week. So the next Tuesday rolls around. I go into Bellevue, same nurse at the nursing station. And I go by Mr. Sullivan's room, and sure enough, the guy is sitting up in his bed talking to a doctor. And I think, wow, that was one hell of a hand massage. I'm sure that it was all my doing. So I'm feeling all Florence Nightingale about it all, and I go down the rest of the hall, and I meet a couple other patients, and I come back in to the room, and I say, Mr. Sullivan, it's so great to see you sitting up and feeling well and talking. And he looks at me, and he furrows his brow, and he says, who the hell are you? So that's when I learned a little bit about, I think, what you go through as nurses. You connect with people, you care about people, you think about them for weeks, and then you come back, and maybe they don't thank you, and maybe they don't remember you, but you have touched them, and you have gotten through. So here's one thing that I know about nurses. There are a lot of traits that you have that I've grown to admire enormously, but the biggest one, the best one for me, is the ability to be non-judgmental. And here's how I feel about that. You have been trained to care for everyone. And that might seem small, and you might think it might be easy, but it's not. You'll do it because that's what you do. You care for people, you touch us, you understand us, you know what makes us tick. You know our families, you know our communities. You will treat us, no matter what color our skin is, no matter what religion we practice, no matter what sexual orientation we have, and in this day and age, no matter what political party we are, and that's probably the biggest challenge. You'll have to put your feelings aside day after day, and that, to me, makes you unbelievably unique and valuable citizens, perhaps more valuable than any other professional I've met in my career. So my advice is speak up, be noisy, let people hear you. You are coming from an extraordinary place with a set of skills that is unparalleled. That issue about being non-judgmental, every day it will get reinforced with the work that you do as you care for others. And that makes you so valuable in our society. I guess I've grown to believe that decency is in somewhat short supply in this country, but not in this room. Not in this room at all. I think it's why I've stayed in the world of nurses as long as I have. I can tell you this. You have chosen a profession that will bring you great purpose in life. It will be hard, but each day you're going to make a difference. And I promise you that as you go through life, you'll find that making a difference and having a purpose is fuel for your soul. So good luck to you. We need you, and I congratulate you for every ounce of work and every moment of time that you've spent here. Welcome, class of 2018.
So, Carolyn Jones, by virtue of the authority vested in me by the trustees of the State University of New York, the faculty of the State University of New York concurring, I confer upon you the degree Doctor of Fine Arts, honoris causa, and invest you with the rights and privileges pertaining thereunto. In token thereof, I hand you this diploma, and we have already vested you with a hood appropriate to that degree.
Dr. Roberta Rowland and Dr. Roberta Rowland, Director of the Undergraduate Program, and Dr. Joyce Scarpinato, Director of the Graduate Programs, will now present the Student Leadership Awards.
The Student Leadership Awards are presented by the faculty of the College of Nursing to students who have demonstrated outstanding qualities of leadership, ability to work effectively with others, and has had active participation in the College of Nursing activities and committees. It is my pleasure to recognize Nicholas Nettie as the undergraduate recipient of this award. Nicholas, please come forward to receive your award from Dr. Rowland.
It is my pleasure to recognize Rachel Bailey as the recipient of the Graduate Student Leadership Award. Rachel, please come forward to receive your award. Dr. Austin Ketch, Dean of the College of Nursing, will now present the Distinguished Faculty Award.
As Dean, it is my pleasure to present the Distinguished Faculty Award. The Distinguished Faculty Award is presented by the graduates to the College of Nursing faculty who, in their opinion, exemplify professional role modeling, student advocacy, excellence in teaching, and guidance in academic and career endeavors. The recipient of this year's award is Dr. Michelle Jansen. Will you please come forward to receive your award?
Don't you love surprises? It is my pleasure to introduce Mr. Michael Elaine, President of the College of Nursing Alumni Society.
Good afternoon. As I stand between you guys and the closing ceremony, I'll be quick. It says I have 3 to 5 minutes. I assure you I'll take nowhere near that long. So, but, yes, thank you. So about 10 years ago, I sat where you're sitting, getting my clinical nurse specialist degree. And yes, that is a graduate degree. I know as many of you are probably out in the audience thinking to yourself, what is a clinical nurse specialist? Well, that kind of reflects what the job market was for my degree at the time. So as I was running around, trying to find a job, trying to get everything in order, I wish somebody would have told me, sit down, relax, enjoy this moment, breathe, take a break. You worked hard. You did all this hard work, and you're here now. You are now alumni. As you reflect upon that, think about those that helped you through this. Your family, your professors, but also I want to remind you about your preceptors. Mainly I want to remind you about that is because you soon will be asked to be preceptors. Maybe not tomorrow, maybe not in a couple of months, but I guarantee it will happen. And remember that joy when you found that preceptor and you hunted them down and you're like, will you really precept me? And you were so excited. Remember, that's your job now, to be that preceptor and to bring up our next generation of NPs. In a few months, you'll get a newsletter from the Alumni Association. I want you to use that newsletter as your opportunity to stay connected with the college. We need our alumni. Anybody who's received any type of scholarship from the Alumni Association, that is through the gratuity of our alumni who contribute to those scholarships. Thank you.
This concludes our ceremony. Please join me in congratulating all of our graduates. There will be a reception immediately following the ceremony at the Campus Activities Building. A photographer is available to take photos of graduates with their families and faculty. As a reminder, the graduates will recess to the outside of the building. You will need to meet your graduates outside. Please remain seated until the faculty and graduates have exited.